Hi everyone, Dr. Orit Hickman here from Pain Science Physical Therapy. In this video, I'm going to show you 2 exercises for mobilizing or moving the thoracic spine, which is the middle part of the spine. It's the stiffest part of our spine because our rib cage encloses all of our organs in front of the thoracic spine and then attaches to the front part of the chest at the breastbone. So it's an area that, because it doesn't move a lot, we tend to compensate by getting more motion in our neck and in our low back. And so a lot of times patients will have neck and low back pain, and it can be because the thoracic spine's not moving well enough. And so I'm going to show you 2 different ways that I like to show patients to stretch and move that spine. And when we do this, it's really about motion more than it is about stretch, which means that I don't have patients hold the positions for long periods of time. So the first thing that you can do is you can use a foam roller for this stretch, which sometimes it can help. And what you'll do is you don't have to use a foam roller. So if you don't have a foam roller at home, I'm going to show you how to do this without the foam roller. But if you do have a foam roller, you get into a hands and knees position. You rest your opposite. So right now I've got my right hand on the floor. My left hand is resting on the foam roller. And then I am trying not to eat my hair as I rotate my spine a little bit. So that foam roller just helps make the movement a little bit easier. So I'm just getting a little bit of rotation, a little twist in my thoracic spine. And I'm just rotating like that. Okay? Now, if you don't have a foam roller, then the way you would do this is you could rest your hand on the floor. And then you can rotate. And for some people, what they'll do is they'll bend the opposite elbow and go way, 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 way down. So doing it with the foam roller is kind of a beginner move. And without the foam roller, you can really go pretty far and get some good stretch in the spine. I'm going to show you this from the other side. Okay, so you want to make sure you do this on both sides, unless you're being told to do it only on one side, because that's part of how you're rehabbing in physical therapy. So my left hand is on the floor, my right hand is going through, and then I'm just stretching through and then coming back. And I'm stretching through and I'm coming back. And now the number of repetitions really depends on what you're working on with your PT. Or, as a general guideline, I might have somebody do this like 3 to 5 times. Some people will call that exercise a threading the needle, because you're taking one hand and you're going through and under the other side. So it's kind of like if you would thread a needle. The next exercise I'm going to show you is also for thoracic spine movement. And so you want to rest on one side. And in this position, if you need to, you can put a pillow under your head. I don't really need to. It's really okay if I don't. I'm pretty okay with that. I might even just hold my head up. That's comfortable for me. My hips are stacked. My shoulders are stacked. I'm going to bring one arm up. And when I do this now, I'm going to rotate. But the rotation is not my hand. So if you see this, my hand is going far away and my chest is still facing you. That's not the motion. Instead, I'm going to rotate my spine and my hand stays in line with my chest so it doesn't go too far. And then I come back to a side lying position. So I bring my hand up and I rotate just in the trunk. And my core muscles, my abdominal muscles have to kick in, because my abdominal muscles are going to pull my ribs back over to my starting position. So one hand comes up and then I rotate, and my knees are not going anywhere. They're staying stacked and attached to each other, and I come back. So we call this exercise book openers. I'm going to do this on the other side because we want to make sure that we're doing this on both sides and staying nice and even. Again, it depends on what your goals are with your treatment. So you're bringing one arm up and rotating. Again, my arm is staying in line with my trunk, and then I'm coming back to neutral. So my hips and my knees are stacked. And my shoulders are too. And I'm rotating. And I'm coming back. Again, about 3 to 5 repetitions with that exercise, and that's to get some nice mobility or movement in the thoracic spine. I will do this for patients who have neck pain, low back pain, shoulder pain. A lot of times when patients are coming in for rotator cuff injuries or pain in their shoulder, it's because they're trying to get movement in their shoulder to compensate for movement that isn't occurring in the thoracic spine. So that's an exercise I'll use for lots of different things or lots of different patient complaints. I hope this was helpful. If you thought this was a great video, I'd love a thumbs up. If you have any questions or comments, please put them in the chat below and I will respond. And if you'd like to get more videos like this one, then please subscribe. Have a great day.